Hi and Assalamualaikum to our panelists. We are from Bachelor of Administrative Science and today presentation is about the roles of NGOs in providing healthcare to refugees in Kuala Lumpur.
But first of all, let me introduce myself and my partners. So my name is Nur Shazwani and my partner's name is Nurul Ain.
Refugees can be defined as people who have fled war, violent conflict or persecution and need to leave their countries to find safety in another country by crossing an international border. The refugees need to leave all behind including homes, possessions, jobs and loved ones. The 1951 Refugees Convention is a key legal document and defines a refugee as someone who is unable or unwilling to return to their country of origin. Refugees are eligible for certain basic rights under the United Nations Convention 1951. They have the right to not be sent to their countries of origin if they don't want to go back. The protection of refugees against repatriation also implies the responsibility of the countries of the refugees seek to protect other basic civil, social and economic rights of the refugees that contemporary international rights are covered or to them. The United Nations High Commissioner Refugees also stated in the 1951 Refugee Convention that access to healthcare equal to those of the host community can be enjoyed by refugees, while everyone is entitled to the highest levels of physical and mental health under international. However, Malaysia is not a signatory of the 1951 Convention pertaining to the 1967 Protocol of the Status of Refugees. Refugees protection does not have a legislative basis, rules or administrative procedures. Refugees who come and stay illegally in Malaysia are exposed to the threat of arrest, imprisonment and detention that is contrary to international law. There is no access to jobs, education and healthcare for refugees. Non-governmental organizations have been seen to have a significant influence in the service delivery gaps of government as related to the study, which is in primary healthcare among the refugee community. A few NGOs have conducted health promotion activities and programs based on health services, including the distribution of health information and on how to explore the health system and health intervention and awareness programs for refugees.
Next, regarding the problem statements, getting access to health property is one of the main problems among other problems that the most of the refugees encounter. This was mentioned by UNHCR under the 1951 Refugees Convention. Refugees also have their right to enjoy access to health services as much as the host population has the right under international law to the highest standards of physical and mental health. However, in Malaysia, most of the refugees do not want to receive health treatment due to various factors such as the cost of the treatment, the fear to move around the public and language barriers.
Study will be guided by these research questions, which are: first, do the refugees get accessibility to healthcare in terms of adequacy of healthcare facilities, ability to afford, and healthcare awareness? Second, what are the roles of the non-government organizations in the healthcare services to refugees in Kuala Lumpur? This study aims to achieve the following objectives, which are: first, to investigate the accessibility of refugees to the healthcare services in terms of facility adequacy, healthcare financial and healthcare awareness. Second, to identify the roles of NGO in providing healthcare services to the refugees in terms of healthcare facilities, healthcare financial and healthcare awareness. This is the conceptual framework of the studies. As we can see, the dependent variable is the roles of NGO in the healthcare services of refugees. And following with the three independent variables, first, healthcare facilities, second, healthcare financial, and third, healthcare awareness. A non-governmental organization is a resident-based non-profit organization that operates independently of the government. As stated by the vulgar, NGOs now and again called civil societies are imposed of community, national and international levels to fill explicit social or political needs and are agreeable as opposed to business in nature. As stated by the Oxford Dictionary, NGO refers to a charitable organization that exists depending on the government. Furthermore, an NGO is defined as an independent organization that performs a variety of activities such as charity and many other services that, on the other hand, will attract Malaysians to assist in delivering issues to the government. Healthcare facilities include emergency clinics, essential medical care communities, detachment camps, consumer understanding units, taking care of focuses and others. Healthcare facilities additionally face a surprising high number of patients in crisis cases, some of whom may require special clinics with consideration, for example, therapy for sickness. According to UNHCR, healthcare facilities for refugees are important in order to give early treatment at primary healthcare. These facilities can help to prevent illnesses. Refugees should have access to healthcare same as the host population as stated by the Refugee Convention 1951, which is everyone has the right to the highest physical and mental health standard under the international law. Healthcare financially portrays the condition of an individual's very own monetary circumstances. Its measurement in corporate investment funds, retirement arranging, and the space spent of fixed or non-optional costs. As stated by the World Health Organization, it refers to the public or private measures on preventing disease, promoting health, and prolonging life among the population. Healthcare awareness refers to the building up a comprehension on one's psychological wellness needs and the possibility to be helpless against additional signs of mental illnesses. Besides, as stated by the World Health Organization, it refers to either public or private measure on preventing disease, promoting health, and prolonging life among the population. By having a high health awareness, the refugees may know how to prevent a disease and improve their well-being in life.
Now, let's move on to research method. The research design for this study is qualitative research method in which interview medium has been used for the data collection. The unit of the analysis for this study is NGOs that located in Selangor and Kuala Lumpur area. As for the sample size, we have selected 2 NGOs in Selangor and Kuala Lumpur, and the sampling technique used in this study is purposive sampling in the non-probability sampling method. And then for the measurement, we use in-depth interview for the 3 independent variables, which are healthcare facility, healthcare financial, and healthcare awareness. In order to collect data, we had interviewed 2 respondents that we had selected, which are Mercy and Imarit. And lastly, for data analysis, we had used structured interview to interview 2 selected NGOs. Next, the finding of the research. As you can see in the slides, there are 2 respondents involved in the study. All of them are from Selangor and Kuala Lumpur. These respondents are Mercy from Kuala Lumpur and Imarit from Selangor. In findings, we have identified the accessibility of refugees to the healthcare services in terms of the adequacy of healthcare facilities, the ability of refugees to afford healthcare services, and awareness of the refugees about their healthcare. Both respondents agreed that NGOs in Malaysia play important roles for the refugees to get access to healthcare facilities. This is because most of the NGOs work together with the government. In the interview with Dr. Ahmad Yusuf Yahaya, he stated this refugee system is the same. They will not apply from NGOs because it is not our money. It's our money. Then we apply to UNHCR. So if you go to the NS office, you can see the queue of refugees are coming to register, and some bring a doctor letter to ask for medical money. So 28 Imarit will help process or help irregulars and approach the hospital to make the payment. So we are the UNHCR facilitators to manage cases like this.
Next is the main findings of the roles of NGO in the healthcare services for refugees. First is the roles of NGO in the healthcare facilities of the refugees. The refugees did provide the basic healthcare facilities. However, the facilities provided did not enough to cure all types of refugees' illness. Most of the chronic diseases will be get further treatment at the facilities which not owned by the NGOs. The facilities only limited, and the NGOs need to ensure they coordinate the resources efficiently to ensure the continuity. This is supported by the statement of the NGO representative, which is there are patients who need further treatment. We need to write a letter and refers to the health professional. There are patients that we need to treat, the refers to the hospital. Second is the roles of NGO in the healthcare financial of refugees. The research found out that all the organizations and individuals in Malaysia, including government, NGO, UNHCR, cooperate together to support the healthcare financial of the refugees in Malaysia. However, the financial allocated still did not enough since the refugees are at the level of poverty and did not have money. In addition, there are no significant sources and healthcare finance since the financials are from various sources but still need additional funders to support them. This supported by the statement of the NGO representative, which is we actually hope that there is a body to provide funding for us to pay the remaining 50%. Lastly is the roles of NGO in the healthcare awareness of refugees. NGOs arranges awareness programs about healthcare for refugees. They provide variation on the programs, formal and informal. The NGOs agrees that awareness of healthcare is important to avoid the primary illnesses among the refugees. As stated by the NGO representative in the interview session, we provided health promotion or education for this refugee on the importance of health.
As for discussion, based on the results, it can be said that all research objectives and hypotheses are being supported and achieved successfully. For the first objective, we can see that both respondents have contributed to the provision of alternative healthcare services for refugees in a variety of ways. One of the ways NGOs, particularly response, assist refugees in the access of healthcare services is by offering the refugees with healthcare facilities, healthcare financial and healthcare awareness. For the second objective, which is the roles of NGOs in providing healthcare to refugees, in terms of healthcare facilities, both respondents had provided the mobile clinic as the interset to help the refugees to track their illness and seek for further treatment at government facilities. In terms of healthcare financial, a funder needed to give the NGO fund to cover the 50% healthcare cost balance that was not covered by the government. Meanwhile, in terms of healthcare awareness, NGOs provide healthcare awareness and give knowledge to the refugees about basic healthcare.
Next is the limitation of the research. First is respondent shortage. This study performed in Kuala Lumpur on the roles of non-governmental organizations in providing healthcare services to refugees. There are certain limits to gathering as many NGOs as needed in order to accomplish the study. The respondent shortage had resulted in the insufficient of data to support the study. Furthermore, due to the respondent shortage, the study was limited to Kuala Lumpur. Because the only NGO that agreed to be interviewed in order to conduct the study is restricted to Kuala Lumpur, the amount of data is also narrow. Second is timing study. The study on the roles of non-governmental organizations in refugee healthcare was being conducted at the inappropriate time during the COVID-19 pandemic, in which limit the study. Furthermore, the incorrect timing had resulted in an insufficient amount of data because there was not enough time to find many NGOs that would agree to be respondent in order to complete the study. Third limitation is long process of gathering data in qualitative study. Qualitative method used in the research make the process of getting data by interview session are getting too long. The researchers take a lot of time to get permission and agreement from the NGO to get interview session. In addition, the COVID-19 pandemic data collection was done online using online interviews via Google Meet and Zoom meeting. The online interview had caused the data collection process to take much longer than expected. There are three recommendations for this research. First is extend the study scope. The recent study had a limited scope of study, so it is important to broaden the scope to guarantee the study can be completed successfully. Furthermore, in terms of location, it is preferable for future research to broaden the scope of the study in order to collect more data and achieve better results. This is because in the recent study, researchers only aim on one area for data collection, which is Kuala Lumpur, limiting the researchers' ability to obtain more data. Second is combine qualitative and quantitative method of study. In order to get satisfied and better results, the researchers could use both methods for this study. A qualitative method of research can be conducted through interview session, and the quantitative method can be conducted through questionnaires through Google Form. By doing this, it will provide a lot of different data and information for the researchers. Third recommendation is refugees data gathering. With the cooperation of refugee leaders, UNHCR and the Ministry of Home Affairs, also NGO, may collect statistics on refugees. Data such as the number of refugees by ethnicity, origin, health, occupation, education, and residence, and more will give more statistic result of the data collection, make it easier to access and compile information for future research study.
Finally, conclusion. I would like to reinstate again that this study was conducted in order to study the roles of NGOs in providing healthcare to refugees in Kuala Lumpur. From the findings we had discussed just now, we could see how important the roles of NGOs in providing healthcare to refugees in terms of healthcare facilities, healthcare financial and healthcare awareness. Lastly, hopefully through this conducted study, we will now understand more about the functions or roles of the NGOs in providing healthcare to refugees and to investigate the accessibility of refugees to the healthcare services. Thank you. That's all from us.